People wake up on a normal day and suddenly something happens that changes their lives completely.
Pediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and he's got an arterial bleed from his leg.
High-speed RTC moped into wall.
Jesus Christ, what happened? You all right?
I love my wife.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
I think it's going to be one of those days.
A place where life,
Darling, what's for dinner?
love,
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Hurts.
Is it that wrist?
Yeah.
OK, so you obviously took one look at it and thought, this doesn't look quite right.
I just gently went like that.
I hate A&E. Hate it.
OK, everybody with new X-ray in 20 seconds.
Today, RESUS is being led by consultant James.
Hello, RESUS. It's James here. I'm the ED consultant on for trauma. We've got a trauma that's going to need your assistance. It's coming by helicopter in 10 minutes' time. A lot of doctors have parents as doctors, which I didn't have. My dad is an engineer, although I think his parents would have liked him to be a doctor. I think he would like everybody to be an engineer. So I need you down here in 10 minutes with your consultant. Is that all right? My parents asked me what I'm going to specialise in. That's the sort of curse of a lot of people in emergency medicine, say, OK, you've done that for a while. Are you going to get a proper job now and as a doctor where you're not doing night shifts and you can leave all that stuff to the young guys coming through? I want Matt and you. This has been for 8 hours. I think it can wait another 20 minutes until the other ones come. But this is my proper job. But I'm going to just have a look at your chest. All right, be a bit cold. Ready? 1, 2. Oh, it's a bit cold.
OK, well, you have broken the bone in your wrist, OK? She will need a cast.
My dad said he blinked when he was 25, and all of a sudden he was 55, and he didn't quite realise how that happened. It's a cliche to say kids grow up fast, but you're so occupied with it.
Ollie, I'm having a cast.
And then all of a sudden they're 8 years old and 9 years old, and so I've got a couple of amazing kids, but I can't believe they're this old already.
I was on a tennis court, running.
Somebody tripped you over?
Yes.
You become forged as a parent over time with the stresses and joys of it.
I know.
Yeah.
Sometimes your kids can drive you crazy, but you still absolutely love them and you value that relationship more than anything.
Be a bit careful because I don't want to see you again.
Phone's ring.
St George's Hospital. Okay.
About 20 minutes. This one, it could be head injury because of the mechanism, but
30 feet.
you want me to put that?
Yeah.
A 32-year-old man is being brought to St George's after injuring himself doing some DIY.
So the next trauma has fallen 30 feet. So they're being brought in by mechanism. 30 feet seems like a proper amount.
Major trauma.
Yeah.
Major trauma.
The Matt is coming in 2 minutes. We need another doctor as well, don't we? Hello, into 6, please. Hello, coming in.
Hold on.
1, 2, 3.
Do you want to do the handover?
Yes, this
Great.
is Mark's 32 years of age, normally fit and well. Today he's up some scaffolding about 30 foot. It's come off the top. He's got a small abrasion to the back of his head. He's complaining of pain in his lower back to the right-hand side. Pain score of about 3. Couple of abrasions to the legs.
Hello, sir. Okay. Just going to do a quick survey of you, all right? Trachea is central.
I'll assess him.
Can you take a deep breath in and out? Symmetrical chest wall expansion. Any pain there? Or here?
Mark's mum and dad are rushing to hospital to be with him.
There was a knock on the door. A youngster from over the road, Mark's neighbour, said to us, "Do you know a guy called Mark lives down in Bothwell?" So we said yes. He said, "Oh, he's just had an accident." Straight away you think, what sort of an accident? He said, well, he had a ladder on top of some scaffolding and it's just collapsed. And we didn't know how bad he was. You just don't know where your mind is at the time. You just want to be with him.
He was conscious when he's being transferred, which is a good sign. Doesn't mean he doesn't have a head injury, but it means at least his brain is still working at the moment. With that falling onto your back, you'd be terrified about a severe spinal injury, and they can be easy to miss.
Don't shake your head. Just say yes or no if it causes you any pain, OK? You have any pain here?
No.
I'm going to keep going, OK?
Yeah.
Here?
No.
Here?
No. A little bit.
So that's about L5, S1.
You find one problem in trauma, you say, fine, we've identified that. What else has he got?
OK, just tell me if it feels normal, OK? Does that feel normal to you?
Yeah.
And there, that side?
Yeah.
If somebody tells you that your boy's had an accident, you just think the worst straight away.
You're going to roll back, OK? On roll, OK? 1, 2, 3, and roll.
All that was on my mind was Mark and how is he? You don't know what sort of condition he's in. You don't know what he's broken or how hard he's fallen. Has he damaged his back? Has he, you know, you just don't know.
When did the ambulances stop being white?
No, you've got a bloody good point there.
Ambulances used to be white, but they've been this colour for a long time, but I don't remember them changing, if you know what I mean.
Oh, there you go. You can't even see the ambulance.
All right, just take a picture of the ambulance.
Oh, look at those horse teeth. Oh, forget that. Maybe I'll just message her and say I'm in the hospital.
Yeah. But I think they changed when they changed to sirens. Because they used to be da-da-da-da-da-da.
Yeah, yeah, yeah.
So now they're high pitch.
Yeah, yeah.
"32-year-old Mark has fallen 30 feet from scaffolding outside his house. Doctors are concerned he may have damaged his spine and suffered severe internal injuries. His parents have arrived in RESUS.
How I got there, I don't know. I'm very emotional and my eyes were just watering all the time because I just didn't know what to expect. And then we found out that he'd gone straight to the trauma unit. It's just shock. You just want to be with them. Unfortunately, my father left us when I was about 14, I think it was. And Mum was just amazing after that. She looked after us, she protected us. Even when it come to buying a house and we didn't have enough money, Mum come in, so how much do you need? So, well, I only need £500. It was a lot of money then, £500. But Mum sorted it out for us. Once my father left us, she devoted her life to us, really. Always there for us, as I hope I am, and Bob for my children. That's probably why we're all so close.
You're glad you got a teddy bear? They're nice, aren't they?
Kids, turn around. Kids, turn around. Children, turn around. You don't need to watch. Turn around. Ella, turn around. Ella, turn around. Sorry. Stay here. Just look that way. Bye. Right, let's go. I don't know why he was so angry.
We needed to see the nurse.
Mark is back from the CT scan.
Hello, how are you? So I've got them to look at your neck first, and they can look through all the other images. There's a couple of thousand of them, but the neck is fine. So that's fine. So we can lose all this stuff again. Good, and I'll just let them get the full report. Oops, sorry, yeah, that's fine.
I knew what he'd done. I knew what he was going to do because I asked him not to do it. I said to him, we'll do it together because we usually do most things together anyway.
No problem, come in, OK. He said that he's waiting for the earache. He said, don't call him yet. My dad will panic.
Yeah, sunshine.
Obviously, as you're getting older, you can't do as much as what you'd like to. What he was trying to do was to save me going up the scaffold or up a ladder, and he was going to do it himself.
So what's the cut? He's got fractured. So what did you do, land on a rock?
Just landed on the rocks.
What did you just go?
Just went backwards.
No.
Right, we do everything together, don't we?
I know, but I just...
Because you're thinking, I want to do it because
Well,
Dad's
do you know-
busy.
I don't like to see my boys hurt. I'd much sooner it had been me. To be hurt, even if it had been broken arms and legs, I'd still sooner it had been me than him laying there. I'm his dad. I'd sooner be there than him.
But it's weird being here in the reverse. I'm so used to being the dad and taking one of the kids to A&E.
Because Ben's the one that's most likely to break himself on something.
The last thing Ben did was try and saw through his finger. You're actually like father, like son, really.
It was a simply wonderful day yesterday. It was like half an hour wait for urgent care all day. It was crazy. Because everyone was waiting at home for the football. No one was hurting themselves. Now everyone's going to be miserable today.
go down?
It will do eventually. Okay, what you need to do is relax, okay? You're making it go up. Just need to breathe deeply and relax.
9-year-old Robert has come to A&E with his dad, Marcus.
The whole thing with his heart it's been a bit scary at times. My understanding of what it is he's got an extra circuit that leads to his heart. I think most people have 4 and he's got a 5th one. And occasionally what can happen is that will short circuit so that it's actually only pumping through one chamber in his heart.
Right, so let me have a quick listen to your heart and your chest first, all right?
The first time it actually happened was on Christmas night in 2012, and we were just putting him to bed, and he actually said, look, you know, my heart's quite sore, it feels like it's beating really fast. So in the settee one night, and you know, Carol said, oh, he can't seem to correct it, so I started sort of pumping his legs, and I just said, so are you okay, and have you tried all your exercises? And I just went, boo! And it just almost corrected it like that, because he got such a fright.
Yeah. When does it get more busy? In the evenings.
Yeah, you just went over 170. There it goes again.
Oh gosh, is it going to go to 200?
If it goes to 200, you've got a problem. He could actually end up needing a pacemaker. And I think the thought of a 10-year-old boy having a pacemaker in for the rest of his life and then having to have, you know, batteries replaced every 10 years and maybe the actual pacemaker replaced as he grows. I think that's a scary thought. I'd be lying if I said that it didn't enter my mind that, you know, you could lose him, which is the worst fear for any parent. Is it still hurting?
Yes.
Okay, just take some deep breaths.
Oh my God.
Yeah, just take some deep breaths. Just relax. If it goes too high, they'll come and see you. You're getting worried about it. That's the problem.
Okay, let's not go.
Do you want your DS?
Yeah.
Doctors are still awaiting the formal report for Mark's CT scan.
One of those things, isn't it? It's always after the event.
Yeah, hindsight's a great thing, isn't it? Just frustrated, really. It's just nice to really crack on and get it done, mate.
I know.
So
I got it done. The bond between me and Mark is inseparable. You know, you get the feeling it's like a husband and wife. You know each other more or less inside out, and I feel like I'm that with Mark.
one thing is that, weirdly, I'm glad it was me that done it and not you.
Do you know what I was thinking on the way over? I'm thinking
he done it and not me.
Plonker. I'm thinking to myself, well, I've probably got, what, I don't know, 25 years if I have. And you've got at least 50, so...
I don't think that. In Dad's world, he doesn't want us to be hurt. When we feel pain, he feels it as well. And he almost literally feels it, sort of thing. He's that, I think, in tune with us.
Luke, keep your legs straight off the bed for me, up in the air. Any pain in your hip or leg doing that?
The worse the mechanism of injury, the higher the risk. But amazingly, people sometimes just get away with grazes and cuts and scrapes and nothing worse than that.
Just bend forward slowly.
Having children, I think, is... well, it's life. You know, it's our life. We just love our children.
You should be fine. All right, you'll be very lucky.
Thank you very much.
I'd love him to settle down. I'd want some more grandchildren. That's what I'd love.
Everything that he's ever done for me, my brother, my mum, to be the father that he's been and to be the husband that he's been, that's what I want to be.
Repeat after me. Bread.
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 Toast.
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 Toast, 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 toast,
Toast,
toast,
toast,
toast,
toast,
toast.
toast, toast.
What do you put in a toaster?
Toast.
No, bread.
Oh, that's good.
I grew up never actually liking children and didn't really want children. And it was Carol who sort of convinced me that this was a good thing. Something, face those fears. I've surprised myself, actually, how I've developed into a father, because it hasn't been easy for me.
That's done the opposite.
But, yeah, I wouldn't change it for the world. I love my kids.
Cool. If I'm in a difficult situation with the kids and I'm not quite sure what to say, I often find myself saying something, and then I think to myself, I've heard that before. And I realise it was my dad saying that to me.
Daddy. It's old-fashioned, Daddy.
So I think being a parent, you're always learning, and I don't think you're ever finished. And whenever you think you've got it sorted out and you know how to do it, something changes.
Tell me a really good joke.
It went up to 199 just now.
So have you had it before where it's persisted longer?
Yes, actually he has. He has had it at school where he's then done his breathing exercises and that has calmed it down within the space of half an hour.
Yeah.
So this is reasonably long.
And what have you tried? You've tried your sucking ice and you've tried your
Sucking ice.
breathing.
He's tried blowing out the syringe.
Yeah. You can...
Really seal your lips around it.
It's not shifting, is it?
It's been over an hour since Robert arrived, and his routine breathing exercises have had no impact on his heart rate.
His normal heart rate might be 90 beats a minute, and he was racing up to double that. It's like what your heart would do if you were running up some stairs, but you can't keep running upstairs all day, all night, all the next day. So even a young person is going to struggle with that.
Basically, normally the next thing is drugs to stop it, yeah? Let me have a quick chat and I'll come back and let you know.
Robert will now be taken to RESUS, where doctors will use strong medication to shock his heart rate back to normal.
How much are you going to give?
I don't know what's wrong.
Just relax. And it's all about how you do it, isn't it, to get the most out
Yeah,
of what
so I
you
was going to
give.
give him 3, but then have a 6 drawn up.
I'd give him 4, because that would be underdosing him. It's unlikely to work.
Okay.
It's relatively unpleasant. We want to minimise the number of times we do it.
Fine.
Quite often we end up having to use medicines, and we give them a shot of a very short-acting drug that stops the heart beating for a few seconds, and that is a really strange sensation. So that's pretty scary.
Hello, St. George's.
Never walk when drunk. Never go into the loft if you're over 40 years old.
5 minutes.
Anything in the kitchen is dangerous. Anything in the garden is dangerous. There's not much you can do safely, to be honest.
A woman in her 70s is being brought straight to RESUS after a fall at home. Christine fell just 5 feet from a rockery, landing on her face.
Hiya. This is Christine. She's a 74-year-old lady. Today she was gardening and she's overbalanced, no dizziness at all. She's fallen 5 feet down onto her face on the driveway below.
Okay.
The whole of the weight has then been pushed down on her. 3 head injuries, mouth, nose and eye, possible fracture. She also has tenderness. She has pain in her neck, but tenderness even more so, central tenderness on palp.
You said it's from a standing position, sorry.
So from that height, she's fallen down straight onto her face.
Okay. Hello, I'm James, one of the doctors.
Hello, James.
Sorry to meet you in these circumstances.
Sorry, I was spitting blood.
You don't worry about that.
Christine's husband, Mike, followed the ambulance to A&E.
I told her not to go up there, but, you know, she couldn't resist doing a little deadheading, as she calls it. I don't know how long she's going to stay in. I guess that depends on how she feels. I ran outside and saw Christine laying in this really awkward position. Blood pouring down the drive.
Take care, Christine.
Yes, my worst fear was brain damage. I think brain damage because her head was so badly injured.
Get some obs on her and I'll do the primary survey. And how did you fall today?
I was just heading across a rockery.
Hmm.
But the drive swept away and I just lost my balance.
Did you feel dizzy or have any chest pain before you fell?
No, I
Okay.
just lost my balance because my balance is not overly good when you're balancing.
Have you got any chest pain or tummy pain at the moment?
No, I don't think so. But breathing is a bit sort
Breathing's a bit laboured, is it?
tender.
You have a go. I'm really sorry.
Well, in the early days, I went to work, Christine stayed at home. You know, she didn't have any desire to send the kids to nursery school or anything like that. It was very much she would stay at home until she felt that it was safe for her to go back to work, and I guess they were in their teens before she went back to work. I did a bit, but probably not enough. So I didn't give her the full support I ought to have done, I don't think.
So, Mrs. Bland, what we're going to do is we're going to get a scan from your head all the way down to your hips, OK? Then we'll start looking at your wrist and other things, OK? OK. All right.
Didn't have any guilt at all at the time, but when I look back, I probably had a fairly easy life compared with Christine.
Stay really still for me. Yeah? That's all I need you to do. Look at Daddy, not me.
When I give blood, I like to watch it because I like to...
Yeah, you can do it.
Robert's heart rate remains dangerously high. He's been brought to RESUS, where doctors are preparing to treat him with a drug to reset it.
Can we tell someone to get his Zenzine?
Don't watch it, just look at me. You'll be fine. Strong
I promise.
rugby
You won't
player
feel
like
this.
you.
Okay. All right.
Crikey, the amount of injuries you've had from playing rugby.
His school team won the National School Rugby Championship, and they played 3 matches, and he scored a hat-trick in each match. So out of 14 tries that they scored, he scored 9 of them.
I was going to give blood. You know the church thing?
When you have a child, you hope that they're going to be good at things and you know, quite sporty. It's a sporty world we live in.
I hate having needles.
Yes, you do. We know you do.
But you're really brave.
Yeah, I'm not so sure about that. Right, look at me.
Dangle your
All you need
arm
to
like
look
that.
at me is look at me.
I think that's a scary thought. You know, how would that impact on his love of sport? You know, does that mean rugby would be out of the question, or any contact sports would be out of the question?
Look at me.
I got a needle in my arm. Oh my God. Don't look at that, sweetheart. That's just
Only a little blood.
Just too messy.
You just don't know what will happen over time, whether his body will sort of, adapt to the medicine he's taking, and then the episodes will become more frequent and more severe.
Is that just come out of me?
That's just come out of you. No, don't touch it. Don't touch it.
I want to see.
In my heart of hearts, I think I realised that he will continue to have episodes, and we will have to make that hard decision at some point in the future. He could actually end up needing a pacemaker.
So we're going to put this through. This is the drug that'll make it all better. Then we flush it through with a lot of water.
Okay.
And then 30 seconds, fingers crossed, you'll feel much better.
Come on, pull, pull, pull.
Good job, well done.
Sweetheart.
You still in a lot of pain?
74-year-old Christine is having a full-body CT scan after suffering serious injuries in a fall.
Let me give you a little bonus.
We first met when we were very young, about the age of 8, and we were in the same class together. But of course, we were too young to realise we're going to spend the rest of our lives together.
Breathe normally.
She had really lovely auburn hair. That appealed to me.
Breathe in and hold your breath.
She wasn't a kid that messed about. All her friends at school mocked her for being too serious, too grown up and too reliable and getting on with her work and doing her homework and so on, whereas they were having a good time, you know. Came from her dad. He was a strict person who expected standards.
You can bring this arm back down. All right? That's it.
Her dad died, sadly, when she was in her teens from cancer, and this was an even stronger reason for growing up rapidly, because she had to sort of look after her mum, effectively.
It was quite adventurous, actually. Right, my dear, we're back now. We're in that part where we started. Now, I can give you some more morphine. How are you feeling?
No, I'd rather not, thank you.
You'd rather not. Do you know the scanner that you just went through? You had just a scan of your neck and everything. So what's happening is we just wait a little while. We'll get that report back. One of the doctors will look at it, and then we'll need to clean up your face.
They got the wrist in, which you can see is broken. Yeah, the wrist is in the CT like that. So.
Do you want me to see if your husband's outside?
Yes, he's easily worried, so...
Let's not do that, then.
If he's there, just tell him I'm OK.
Yeah, I'll go let him know that you're OK, then.
The role she's always played with the family as being the person they would all come to when they're in trouble. Fount of all sensible knowledge. What would Granny think? You know, it's that sort of approach.
Mr. Bland. Hi, I'm Sarah. I'm one of the nurses. I'm just with your wife, Christine. We'll let you come in a moment. We've just done a scan of her head and her neck and everything, so we're waiting for the report. Make sure everything's OK and give her a bit of a clean-up, and then we'll come get you, OK? Doctors are with her at the moment, just giving her a full once-over, OK?
This is like history repeating itself. She did this.
She said a couple of months ago, yeah. she said twice in one...
She's not safe to be about.
I'm sure she's...
I told her to stop gardening, but she wouldn't listen.
Well, hopefully this time.
She will listen this time.
Well, she'll listen this time.
Can you imagine life without her?
No. No, I can't. I can't because, you know, we've done everything together. Our entire lives, almost. And the thought of coping on your own is horrendous.
Look where you're going. Look where you're going, baby.
They say men never grow up. He winced. I don't like that. He winced. Oh, God. Good job you're not a lawyer.
You feeling sharp here?
Fine.
Pain?
Fine. Ow! Shit!
Good boy.
Dan! You're free to go.
Thanks for being with me.
That's all right.
So this young man is about to have his adenosine.
Yeah, I think it's from
After breathing exercises fail to lower his heart rate, doctors need to give Robert a powerful heart drug for the first time.
Carry on talking. Got 20 mil flush.
20 mil flush, arm raised, whoosh the arm down. When you get that drug, it blocks the conduction of the heartbeat through the heart, and that can last for 2, 3 or 4 seconds. And you go from your heart beating 180 times a minute to no beat for 3 seconds.
I can't remember who it
Gonna
was.
lift this up. Good boy. You carry on talking to Dad.
We're thrashing whales again tomorrow.
You're not thrashing whales. Good boy.
Gosh, I feel weird.
Yeah, you will do.
That's
That's okay.
Daddy.
So
Deep breath in and out.
talk to me.
Well done.
Because what this is doing is helping bring your heart
How old's
rate
your
down.
sister? 6.
Yes, terrorises his sister. Absolutely terrorises his sister, and she adores him. Do you feel better?
Yeah.
Yeah.
It's back to normal. Do you want to see it?
What? Yeah.
Your heart did. So that's the funny rhythm.
Yeah.
This is when the drug goes through and interrupts that rhythm. That's when you felt a bit funny.
Yeah.
And then that's normal.
Yay!
Wow! Hopefully we'll move you back round the other side to our little ward area, and then we'll be able to let you go home after that.
Okay.
All right? Well done. Thank you.
Thank you, sure. That was the longest one. It happened for at least 4 hours. I can't remember what it's exactly called, but I call it heart beating really, really fast. That's a cool bottle. I try not to think about it. My friends are really... Because some of my friends know about it, some of my friends don't. So they try to help me to ignore it.
Thank you very much.
That's all right. Sometimes I feel a bit worried having this, like when I'm laying in bed. Sometimes I get a bit worried about it. It was great having my dad there, because if nobody was there, I wouldn't have anybody to tell my thoughts to, and if I was sad or worried. But my dad was there to comfort me.
"74-year-old Christine needs a further examination of her eye injuries after falling whilst gardening.
She's got a very extensive, deep laceration. Looks like it's going to the maxillary sinus almost. It's a very complicated wound. Yeah, it's crossing through the eyelid and then sort of extending into the maxilla, sort of next to the nasal region.
I'm so sorry about this.
It's done, it's done, it's done.
Open your mouth.
I've got a plate in there.
You go.
It's one tooth plate, a temporary plate, because she's due to go in a couple of weeks' time for an implant, a tooth implant, from the previous fall, 6 months ago.
Oh, really?
I worry about her now. Asked me a year ago and I would have said no worries at all. Last December, she had her first fall, and it was a shock to both of us because it was so unexpected.
Oh, that really is so short.
My name is Mr. Here. I'm one of the orthopaedic doctors. Hi, nice to meet you. Hi. Just to update you, at this stage, the injuries we are aware of, obviously, are the facial injuries and the right wrist, which is broken, but we'll wait for the formal report. A&E doctors will pull the wrist, so try and get it in a better position, and put a cast on there.
Sorry, where's that hurting?
Just a minute.
That's all right, don't worry, don't worry, don't worry.
It's my ribs.
The ribs are hurting?
Yes.
Okay, okay. Shall we stay at this level?
Don't want to get old. It's horrible. So restrictive. I began to realise that we've got to lead our life a little differently. We've moved our sleeping arrangements from upstairs to downstairs, and that removes one of the strains for Christine getting up and downstairs. You're looking at this person who you love, and you know what they've been like for all your life, and suddenly they're not like that anymore. They're struggling to cope with horrendous injuries.
You just take your time. And let me give you a little bit of morphine to top you up.
I'd rather you didn't take it because it makes me feel really quite
What
peculiar.
happens if we give you just a little bit?
We love giving morphine.
We just don't like you to be in pain.
You can't believe it, really. It's a shock. It's a real shock.
Ophthalmology.
Oh, brilliant.
Hello, I'm one of the eye doctors.
Ophthalmologist Michelle has come to RESUS to examine the injury to Christine's eyes.
We eye doctors are all about light, my dear, so... Can you just hit the lights for me, just so I can have a quick look at those pupils?
Close up that laceration, clean up.
All right, looking up again at the ceiling. We're now in darkness, so that's much easier for me. That's constricting, and she's negative RAPD, so that's good. So there's no compression of the nerve. The nerve is absolutely, so far, looking okay. Don't worry, my dear. Okay, I just need to see where you've lacerated. Okay, so you've got a fairly large laceration there.
Oh, I just wish I could stop shaking.
Body's just in a bit of shock is all.
Yeah.
It's okay, my dear, don't worry about it.
It's just so exhausting.
Oh, I know. And I'm pretty sure they've got you dosed up pretty well on the morphine. You're refusing the morphine. Okay, so this just looks like it went through skin.
Pitching over the edge and not being able to save myself. And the actual thwack is the only word I can use because that is the sound my head made as it hit the ground. I just hadn't had pain like that before. It was such a thwack.
We won't take long at all. Like, I think 15 minutes.
Inside your brain, you feel an 18-year-old. The old age bit seems to happen rather suddenly. You know, you're going along quite nicely and then things seem to happen in quick succession and you suddenly think you're just not what you were.
The thing I admire most is her utmost care for the rest of the human race, and that sounds terribly pretentious. But she really can't be anything other than that. It's the way she is, that she will find good in everybody, even you.
I would hate it if I had a stroke or anything like that. But whilst I can still get on, I get on. And that hopefully is the way I shall continue.
We decided that scaffolding wasn't safe anymore, so we went and bought a proper tower. So we've now got a big 7.5 metre tower.
And yes, we've been up there and finished off the front where Mark fell from anyway. That's the front's finished now. It was a lot of money to buy, but I'd have paid 10 times for it if Mark hadn't have fallen. I wish we'd have had it before.
We're all too concerned in life about, oh, I haven't got the 6-bedroom house or the Ferrari or this, that and the other. But actually what you have got, you should be grateful for and thankful for as well.
First time I took my tablets, it took me about 10 minutes to actually swallow it. I just couldn't get it down my throat. By the time I got it to get to the back of my throat, all the water had gone. So I might have this operation, because if I have that, it might be the end of my rugby career. And couldn't imagine life without playing rugby. I think my dad would like me to play for South Africa when I'm older, or be a banker or an accountant. So as long as I have their support, I'm all right.
I've accepted the fact I've got to do it, and I've learned a lot of new skills as a result, involving things like the washing machine, the Hoover, and so on and so forth, you know, because I never used to do much of that. I do now.
I used to like gardening, but gardening no longer likes me. You've got to look on the bright side, haven't you? It could have been a whole lot worse, you know, and I'm the first to realise that. It could have been, well, it could have been curtains, couldn't it?